Loud from Texas for 5 minutes of questions.
Thank you, Mr. Chairman, Ranking Member, and thank you all for being here today. A very important topic of conversation. I wanted to start with kind of the lead up to COVID and what was happening before then. In 2018-19, I believe the U.S. Contributed about 839 million, China about 80 million. The Rotary Club actually had more investment in the WHO than China. Does the Rotary Club have a seat on the board? No? Okay. China does? Still? Okay. And then some of the items that the resources were being used for in September 2019, the WHO published a paper on addressing the harmful masculinities to improve sexual and reproductive health rights. February 2020, this is right after saying that there's not human-to-human transmission, and then working to correct that. The WHO was busy addressing the important health issues by holding a conference on road safety. Right now, they're still working on groundbreaking research series on health benefits of the arts. There's resources being spent to shift negative attitudes toward abortion and prevent conscientious objection. That's regardless of what you think on abortion, even if you think it's right. This is if you're working to change people's minds on it, that's not providing a scientific medical service, which I would, I'm pro-life. I disagree with abortion, but this is political action, not medical action. Legal recognition of self-determined gender identity and the provision of gender-affirming care, things that the WHO is invested in. Now, this is not protecting countries against the pandemic, and so we continue to be by far the largest contributor to the WHO, 10 times the amount of China leading into the pandemic, but it would have seemed that China had about 10 times the influence during the pandemic in having their issues protected and addressed. And I appreciate the ambassador acknowledging the list that Ms. Lesko so capably presented of the missteps and misinformation that came from China and the WHO, but you kind of shifted the finger to China, which is appropriate, but it was also, her point was in getting back to the missteps the WHO had in protecting it. And so what I wonder at this point is why we're not seeing full-throated response to bring China to account. Why is China still on the board? Why do they get a vote? Will the Biden administration stand up to China and have them removed from the board? Why do they get a vote going forward on any of this? Could you speak to that, please?
Certainly, Mr. Congressman. Thank you for this question because it is important to understand sort of the inner workings of WHO and how it is directed or working in service to its member states. So the way that board elections work or selections work is each region actually puts forth someone from amongst their member countries to serve on the board. Now, there have been times when the U.S. has objected to those nominations. However, not being a member of certain regions, we don't have the say in terms of who they put forward and ultimately nominate to the board, just as they don't have a say in what the Americas regions does to put the U.S. on the board as many times as we have. And so we do in the World Health Assembly object, as we did when Belarus was nominated, when DPRK was nominated, because for the reasons that I'm sure you and your colleagues agree, there are issues with their engagement. However, what we do with their space.
What we're not seeing, though, is bold, full-throated acknowledgement that we need to, there could be a vote held in the board meeting to discipline China, to remove them from it, to counteract their influence in what's going on. I think after you've killed a couple million people, you should not be able to get a vote on the board. And from our perspective, we're continuing to fund this. And so I'll go back to my initial list, which we could add a number of other items to encouraging taxing on sugar and climate change and all these different things. If you are involved in any issue that remotely affects the health of an individual, that seems like a whole lot of mission creep and a whole lot of power that the WHO is asking for, that you're asking us to be the primary funder of with only 1/34th influence on the board. And so how do we, as the people funding this on the backs of the American people, address those concerns when there seems to be a whole lot of mission creep that goes beyond protecting against pandemics?
Well, if I may try to respond again, Mr. Congressman, thank you again for that question. With regards to WHO's program of work, they do work across the spectrum of public health, not only in pandemics or outbreaks. Importantly, when it comes back to the benefit of WHO for Americans, their work in non-communicable diseases is applicable to us and even justifies our engagement with them, whether it's on diabetes or cancer or other issues that we face here in our country. It is an important partnership that we maintain.
The vast majority of our input is voluntary, and my understanding is that comes with our ability to earmark what that is for. And we have great concerns. There's a lot of opacity in us getting to what we're earmarking and what it's actually being spent on. So we can talk about transparency, the need for transparency of what we're earmarking for. We can't find the information on that. So it'd be great if you could help us with that. But then it gets earmarked to these very vague categories that when we go to what the many of the items I read are under these vague, broad categories on the WHO website. And there are things I don't think the American people feel like they should be funding when it comes to, yes, happy to work with polio and those kind of things. A number of these other things shouldn't be on the backs of the American people. Thank you. I yield back. Thank you, Chairman.
I now recognize Mr. Kuda from Hawaii for 5 minutes.